medical schools. So I had to stand at the podium. All of you people were the classmates I tried to sit next to on test day in high school. Thank you, Sylvia, for that introduction. It's such an honor to be on the same stage as Sylvia Perez, Dr. Weaver, Dr. Proby, and Dr. Lindau. But I must say, I think they've saved the best for last. So this old woman goes to the doctor, and the doctor says, "Your test results came back, and I'm afraid I have some bad news for you. You have cancer, and you have Alzheimer's." The old woman says, "That ain't so bad. At least I don't have cancer." Along with the many roles I play, about 2 years ago, I became a cancer patient. I've always been a good patient, always followed my doctor's orders, had my yearly checkups, blood work, watched my cholesterol, had a mammogram every year, exercised, ate right, took my vitamins, never smoked, and hardly drank enough as far as I was concerned. So it was a surprise when I was diagnosed with breast cancer. That was April of 2012. Fast forward a year later to when I had completed surgery, 4 rounds of chemotherapy, radiation treatments, and after completing my treatment, my oncologist at the University of Chicago put me on tamoxifen. As a follow-up to our appointment, he told me I could email him if I had any questions, reactions, or comments to the tamoxifen. It was in an email that I said the meds were fine, but as a side note, and I'm not even sure why I put this in there, I mentioned that I had no libido. He replied, in an email of course, that maybe I would like to make an appointment with Dr. Lindau at the PRISM Clinic. I have to say that cancer challenged me to be accepting. I had to accept my diagnosis, accept the treatment plan that was laid out for me, accept all the side effects from treatment because I wanted to get well. And during that phase of the cancer journey, there were many resources available to help ease the discomfort that comes from the illness. However, there is one area that's not addressed in the same fashion as the disease, and while I understand that sexual function after treatment might not get the billing that follow-up appointments, mammograms, MRIs do, I believe it is as important as these other parts of the follow-up protocol, and in some ways even more so. While every cancer patient wants the best outcome, and as you move through this process, that's the priority, there are things that happen that you did not count on and you must live with. For me, chemotherapy helped eradicate the cancer, but it also put me into sudden menopause. Something I did not realize would have the impact on me, it did. There is also the experience of needing to detach in some ways from your body as you go through treatment. There are so many people looking at, touching, x-raying, measuring, moving it about. That's the best way to cope. So I disengaged on some level from the personal and got very clinical about my body. So when all that was done, coupled with the physical implications of sudden menopause, it should surprise no one that intimacy was challenging. Enter Dr. Lindau in the PRISM Clinic. I have to be honest with you and tell you I was skeptical at first. I could not imagine what a doctor could offer to me in this arena. I have never been happier to be proved wrong. What Dr. Lindau did was very simple yet profound. She spent most of our first appointment listening. Being a nice Irish Catholic girl from the South Side, I thought it would be difficult for me to try and articulate the change that had occurred with my husband from the wonder of what it was before cancer to something that was unfamiliar to me after cancer. But Dr. Lindau made it extremely comfortable. She welcomed the dialogue. It was a significant experience because she made me feel hopeful. She gave me the assurance that there were things that could be done to counteract the dysfunction that had occurred as a result of treatment. It's very difficult to explain how, on the one hand, I was relieved to be free from cancer, yet grieving the loss of a very important part of my relationship with my husband. I was so focused on getting well, and I naively believed that once I was well, life would return to how it was pre-cancer. But that's not true. My body, as well as my spirit, had been through a lot, and I was shocked in many ways at what life looked like post-cancer. And here's the other thing that I came to find out. I am not the only cancer survivor that has this experience. Every single woman that I have talked to who has been through breast cancer treatment experiences some change in sexual function. I just want to make sure that that's clear. I know that this can be an uncomfortable topic to discuss, but I am confident when I say that if a patient was asked about this, she would be interested in finding out about Dr. Lindau. I am handing her pamphlet out all the time. I recently had to go for follow-up for some genetic testing I had done. Before I met with the doctor, I had to fill out a form consisting of questions about my health post-treatment. It was a long document, and it asked about my respiratory system, my circulatory system, how my bones and joints felt. It even asked if I had chronic ringing in my ears after treatment. And yet there was not one question about sexual function after treatment. Cancer treatment affects your sexual function, that's a given, and yet it's not talked about. I asked the doctor and the nurse practitioner during the meeting why there was not any questions about sexual function. I said it in a very nice way. And they looked at each other and said they didn't know why and agreed that it should be on there. I truly believe that you physicians are called to this medical field as your vocation. It takes a unique individual to deal with all the responsibility that comes with being a doctor, and a good doctor is such a gift to a patient. So I am confident that now that you know there is this area of patient care that needs to be addressed, you will take on the challenge, and you have Dr. Lindau to lead the charge, because that is what it has to be. It's so appropriate that the name of Dr. Lindau's clinic is PRISM, and while I know it stands for Program in Integrative Sexual Medicine, it means so much more than that. Jonathan Kellerman, a psychologist and author, says life is like a prison. What you see depends on how you turn the glass. I'm not sure what it was that made Dr. Lindau listen to that small voice that told her to turn the glass a different way. But I, and I'm sure countless other women, are grateful that she did. What she helped me do was separate the glaring white light of post-cancer treatment into a spectrum of beautiful color, and for that I'm forever grateful. Keep up the good work. Thank you.